We will move on now just to do a quick survey of bias in scientific research. Now, we all kind of know what bias is in social science, right? Bias is having a preconceived notion about something or leaning in favor more toward one thing than another, with no, evidence for our viewpoints. But bias in scientific research is a little bit different. So when we talk about bias in scientific research, we are talking about a systematic flaw in the design, conduct, or analysis of a study that can cause the results of the study not to accurately reflect the truth about the source population or about the situation, not kind of on purpose. We're not lying. It's just a flaw in the study design. So two types of bias, and there are many, many types of bias, but two examples are sampling bias, where the sample of study participants does not accurately reflect the true population being studied. So say I'm doing a study on college students in Naperville, and I decide to also include some of their parents. Well, then, if that sample is supposed to be representative of college students of Naperville, then I would have some sampling bias in there. There's also something called recall bias. And this is where, you give surveys and questionnaires to people, and perhaps their memory of the past does not accurately reflect the truth of events. So if I'm doing a survey on children who ate apples in childhood, and I ask this group of people, our class, how many apples did you eat a day during childhood? Are you going to remember? How many apples did you eat a week? Well, you're going to have a little bit of recall bias, because how are you going to remember that, right? You're not lying. It's just kind of an impossibility to accurately remember that. So we have this section of our journal articles where we address the risk of bias. And we usually put that in the limitation section, which is within the discussion section, where we kind of say, well, we could have had this type of bias and we could have had this type of bias. We did our best to guard against introducing bias into our study, but it may have been introduced in this way. And you'll see as you read journal articles in the discussion section, there may be a limitation section, and you can say, they'll be like, oh, there might have been a little sampling bias or something. So just take that into account. Also, we had this bias pyramid that we went over in evidence-based practice. And we can see our different study designs and how the risk of bias, it actually goes down as you go up the pyramid. So we can say that someone's ideas or opinions, those are very, very influenced by bias, right? So there's a huge risk of bias. When we get to case reports, those are reports of one patient, there's a little bit less bias. When we get to case series, reports of maybe 10 or less patients, there's a little bit less bias. And then we start getting into the meat of things. We start doing, next would be actually cross-sectional studies, which we talked about last week. Then case control studies. Then cohort studies, which we're going to talk about next. Then we're going to have some experimental studies. These are our randomized controlled studies. And then we can have, at the very, very tippy top, we have systematic reviews and meta-analyses of randomized controlled studies. And those are kind of like the most accurate kind of studies we can get way there, all the way up at the tippy top. But as we discussed with the lung cancer situation, we can't always do an experimental study because it's unethical, because it's not feasible. So we make do with these different types of studies. And that is all I have for you today.